New data published in the Journal of the American Heart Association June 2026 found that GLP-1 medications were linked to fewer blood clots and lower stroke risk in people with autoimmune disease and obesity. Nearly 3/4 of the people in the study were women. So if you are perimenopausal or postmenopausal, this is an important one to tune into. Cardiovascular disease is the biggest killer of women. More women die of it than all cancers combined. It's the reason I'm on a GLP-1 medication. I'm Jessica Brown. I'm a nutritionist, author of Beyond the Shot and The Loving Diet. Remember, this is not medical advice, and I'm not a doctor. Okay, facts. This was not a drug trial. Researchers used real health record data from over 21 million patients across Florida, Georgia, and Alabama, and then mimicked what a randomized trial would look like by comparing similar people who did and did not start a GLP-1 medication. Okay, so why this matters for a lot of women. Autoimmune disease already raises clot and heart risk because of chronic inflammation, and it mostly affects women. You add in menopause, which has its own hormonal and immune shifts, and that risk climbs even more. Everybody in the study had obesity and an autoimmune disease condition. Some started a GLP and others didn't, but each person was matched to someone similar in age, sex, BMI, and health status when the treatment started. They matched 13,000 GLP-1 users to 13,000 non-GLP-1 users, and then they compared them. GLP-1 users had 31% lower risk of pulmonary embolism, 17% lower risk of blood clots in the veins, 21% lower ER visits, and a 44% lower risk of death. There was a modest but significant drop in stroke and TIA risk, about 13%. Heart attack risk only trended lower without reaching significant, and rates of procedures like stents were about the same between the groups. So this is a strong signal on clots and mortality, not a clean sweep across every outcome. This is health record data. So it shows association, not proof of cause and effect. People prescribed GLP-1s may have better access to care, and the study could not measure how much weight each group actually lost. Are you on a GLP-1 medication? What are your health goals?